fan of HCG therapy, not only for men with hypogonadism, but also for individuals trying to lose weight. So let me just do this real quick. I want to comment on HCG because a lot of times there's a lot of crappy literature that's out there that says, no, it doesn't work, it doesn't work. I want you, if you get a moment, purchase my book on Amazon, and it will go through and it'll read every one of those studies, and they're just horrible studies. And I'll tear them apart and I'll show you that in fact other studies have been very, very beneficial. So let me explain real quickly how HCG works. First of all, the key for HCG is people will go, well, wait a second. Women are pregnant, have high HCGs, and most women I've seen that are pregnant really are not skinny. They're not losing weight. They're gaining fat around their tummy, etc. And that's true. But the thing is that when a woman is 30 weeks along, her HCG levels are 70,000. We're using 200 to 300 units. When a woman is 5 weeks pregnant, i.e. the first time she checks the urine pregnancy test and it's positive, she has to be 17,000 units of HCG to be positive. We're only using 200 or 300. So what's the difference? Obviously there's a big difference. And what you do is you calculate the 5 weeks where it's 17,000, and you go back to day one of creation. And what you find out is that about day 3, 4, or 5 after creation, the HCG levels are around 200 to 300. So what does that mean? Interestingly, it's a very, very difficult time because right now the brain is being developed those first 3 to 10 days. The brain is being developed. The heart is being developed. By 19 days, the heart actually has a heartbeat. The skin, all the vital organs are being developed. So what's going on? This is big time. So how does your body get the needed nourishment that it requires to do all these tremendous metabolic processes? And the answer is, mom has no idea she's pregnant. How many women at 3 days after conception know they're pregnant? Very, very few. And so how can they eat better? They're still drinking alcohol or smoking or whatever. They don't know it for 5 weeks. But the body knows. Her body is creating this HCG that's traveling to her fat cells. And there are HCG receptors on fat cells in both men and women, by the way. And it's taking the fat out of those fat cells, delivering it to this growing embryo, nurturing it with the energy that it needs. Interesting, it also, by releasing this from the fat cells, produces other components like leptins that go back to your brain and tell you to stop eating. So the combination of everything is basically telling this mother who's eating wrong, eating badly, to either not be hungry, number one, because her body's taken over all the supporting of this embryo via the fat stores. And it's not until about 5 weeks that mom knows she's pregnant that all of a sudden she says, geez, maybe I better be eating better. Maybe I should stop smoking. Maybe I should stop drinking or whatever. But during that time, those first 3 to 10 days, the HCG supports this growing embryo. That's also how it works in you and I. What it does is it tells your body to use your belly fat as the primary source of energy. And that's burning the belly fat is the key to HCG. Now I like a low carb diet. So utilizing a low carb diet, you have very low insulin levels. Low insulin levels are great because spiking insulin levels, like if you eat some carbohydrate or something, spiking insulin levels will tell your body to store more fat and block you from releasing any of the fat. Because quite frankly, insulin is a fat storage hormone. Repeat after me, insulin is a fat storage hormone. Check your physiology book. That's what it does. It stores more fat. We don't want high spiking insulin. And when you're eating sugars or this quote low fat diet, which is just another goofy name for a lot of sugar diet, you need to be eating a low carb diet. You need to avoid a lot of the carbs. The grains specifically, there's a lot of studies out now and a great book called Grain Brain by Dr. Perlmutter Naples, and also a great book called Wheat Belly that talks about all the problems with these wheats making us fat and how they're so dangerous. So I like HCG used with about 20 grams of carbohydrates a day, and no caloric limitation though. And I have so many patients now that are just unbelievably happy, and it's pretty easy. You can go on and off of it. You do it for 28 days, go off for a week or so, come back onto it until you achieve your desired weight. This is what the book is. It's called The Siesta Beach HCG Lifestyle. You can get it on Amazon. But it's a combination of navigating and optimizing success with testosterone therapy and other therapies. So it's a combination of things, not just hormone balance, but hormone balance will allow this process of improving body composition, not always reducing weight because it's increasing muscle mass and reducing belly fat and fat, but fat weighs 1/5 of what muscle. So weight loss isn't the key here. The key is changing body composition. Your pants falling off, you're tightening your belt because your pants will fall. That's the key. That's the success.